If you're over 60 and you wake up almost every morning with thick phlegm sitting in your throat, constantly clearing your throat before you can speak, or coughing just to feel like you can breathe comfortably again, I want you to know something important. You are not necessarily just getting older. That morning mucus can have a reason behind it, and sometimes the reason is surprisingly simple. In fact, there are 5 common causes that many seniors overlook, and one of them can continue night after night without you realizing what is happening while you sleep. Stay with me because by the end of this video, you'll understand what may be causing that morning phlegm, what clues your body can give you, and which warning signs mean you should talk with a healthcare professional rather than simply trying to clear your throat again and again. First, let's talk about what you are actually experiencing. You go to bed feeling relatively normal, but several hours later, you wake up with a dry or coated mouth, mucus in the back of your throat, a need to cough, or that frustrating sensation that something is stuck there. You swallow, clear your throat, drink some water, and maybe it improves temporarily. Then, the next morning, it happens all over again. If that sounds familiar, you are certainly not alone. As we age, changes in the nose, throat, saliva production, medications, sleep patterns, and digestive system can all influence how our airways feel during the night. And there is an important distinction here. Mucus itself is not automatically a bad thing. Your respiratory system naturally produces mucus to trap dust particles and irritants. The problem is when mucus becomes unusually thick, excessive, persistent, or associated with other symptoms. The first possible reason is postnasal drip. This is one of the most common explanations for that annoying sensation of mucus sliding down the back of your throat. Your nose and sinuses continuously produce mucus, and normally you swallow small amounts without even noticing. But when your nasal passages become irritated by allergies, a cold, sinus inflammation, dry air, or other triggers, mucus production or drainage can change. Instead of feeling like nothing is happening, you may suddenly become very aware of that mucus collecting in the throat, particularly when you are lying down. You may wake up swallowing repeatedly, coughing, or clearing your throat. You might even feel as though you have a lump in your throat when there is nothing physically blocking it. If you frequently have a stuffy nose, sneezing, nasal drainage, facial pressure, or seasonal symptoms along with your morning phlegm, postnasal drainage becomes an important possibility to discuss with your doctor. The second reason is mouth breathing during sleep. This one is easy to miss because you may have absolutely no idea how you breathe while you're asleep. If your nose is blocked, if you snore heavily, or if you have a sleep-related breathing problem, you may spend part of the night breathing through your mouth. Air moving continuously across the mouth and throat can contribute to dryness and irritation. When the tissues become dry, the mucus that is already present can feel thicker and stickier. That can leave you waking up with a coated tongue, dry mouth, scratchy throat, bad breath, and thick mucus that seems difficult to clear. Think about what happens when a small amount of water evaporates from something wet. What remains becomes more concentrated and sticky. Your throat is not exactly working like a glass of water, of course, but the basic sensation can help explain why secretions may feel thicker when the mouth and throat become dry. And here is where I want you to pay attention to another clue. If your partner tells you that you snore loudly, stop breathing briefly during sleep, gasp, choke, or make unusual breathing sounds at night, do not simply assume that your morning phlegm is the whole problem. Persistent loud snoring and witnessed breathing pauses can be signs of sleep apnea, which deserves medical evaluation. You do not need to diagnose yourself. Simply recognize the pattern and bring it up with a healthcare professional. If you also experience significant daytime sleepiness, morning headaches, difficulty concentrating, or repeated nighttime awakenings, that conversation becomes even more important. The third possible reason is something incredibly ordinary: dehydration and a dry sleeping environment. You may not think of hydration when you think about mucus, but the amount of fluid in your body can influence how your mouth and throat feel. Older adults can also have a reduced sensation of thirst, meaning you may not always feel thirsty even when you could benefit from more fluids. At night, you naturally go several hours without drinking. Add a dry room, heating, or air conditioning, mouth breathing, or a habit of drinking very little during the day, and you may wake up feeling like your throat has been coated with glue. But there is an important balance here. You should not respond by drinking huge amounts of water immediately before going to bed, especially if you already wake frequently to urinate or have been told by your doctor to restrict fluids because of a medical condition. Instead, focus on appropriate hydration throughout the day according to your individual needs and your healthcare provider's advice. Small, consistent habits are usually more sensible than trying to compensate at bedtime. As you improve your overall hydration habits and reduce unnecessary dryness, you may notice that your mouth and throat feel more comfortable when you wake up. Now, I want to ask you something. When you wake up with phlegm, is your biggest problem the mucus itself, or is it the constant need to clear your throat? Tell me in the comments. Your answer could help someone else realize they are experiencing the same pattern. The fourth reason may surprise you because it can involve medications. Many medications commonly used by older adults can contribute to dry mouth. This includes certain medications used for allergies, blood pressure, mood, bladder symptoms, pain, sleep, and other conditions. That does not mean your medication is wrong for you. And it absolutely does not mean you should stop taking a prescribed medicine on your own. It simply means that if your dry mouth and morning throat symptoms began after starting a medication or changing a dose, it is worth mentioning to your doctor or pharmacist. Sometimes the medication is not directly increasing mucus at all. Instead, it may reduce saliva or contribute to dryness, making normal secretions feel thicker. That distinction matters. You might think, my body is producing too much mucus, when the actual issue may partly be that your mouth and throat are too dry to handle normal secretions comfortably. So take a moment to review your medications with a professional if this has become a persistent problem. A healthcare provider may be able to identify whether a medication could be contributing and whether there is a safer adjustment or alternative appropriate for you. The fifth reason is acid reflux, including a form commonly called laryngopharyngeal reflux. You may already associate reflux with burning in the chest, but not everyone experiences the classic heartburn sensation. Some people notice throat clearing, coughing, hoarseness, a sensation of mucus, a lump in the throat, or irritation instead. Reflux can become especially noticeable when you lie down after eating. That is why your nighttime routine can provide an important clue. If you regularly eat a large meal very close to bedtime and then lie down, you may be giving reflux an opportunity to become more troublesome. Some people also notice symptoms after particular foods or drinks. The solution is not to assume that one specific food is responsible for everyone. Instead, pay attention to your own pattern and discuss persistent symptoms with a healthcare professional. Depending on your situation, changes to meal timing, portion size, weight management when appropriate, and medical treatment may be considered. Now, let's put these five possibilities together because this is where the bigger picture becomes useful. Imagine you are over 60, you eat dinner late, you have some nasal congestion, you snore at night, and you take a medication that contributes to dry mouth. Any one of these factors might be manageable, but together they can create a perfect environment for waking up with thick, uncomfortable secretions. This is why simply saying, I have mucus because I'm getting older, may not give you the complete answer. And there is another mistake I want you to avoid: repeatedly forcing yourself to clear your throat all day long. It feels helpful for a moment, but frequent aggressive throat clearing can irritate the tissues and potentially create a cycle where the throat feels even more uncomfortable. If you constantly feel the urge to clear your throat, try taking a sip of water when appropriate, swallowing gently, or using other measures recommended by your healthcare professional rather than repeatedly forcefully coughing. Your morning symptoms can also give you useful information. Clear or thin mucus can occur with normal secretions, allergies, or irritation. Thick mucus may become more noticeable with dryness or congestion. Yellow or green mucus can occur with infections, but mucus color alone does not prove that you have a bacterial infection or that you need antibiotics. And if you notice blood in your mucus, significant breathing difficulty, chest pain, persistent fever, unexplained weight loss, trouble swallowing, severe or worsening symptoms, or a cough that refuses to go away, do not simply watch it indefinitely. Those symptoms deserve appropriate medical evaluation. You should also pay attention to how long this has been happening. A few mornings of mucus during or after a respiratory infection is very different from waking up with the same problem every single day for months. Persistent symptoms deserve a proper history and examination because the cause could involve your nose, sinuses, mouth, throat, lungs, digestive system, medications, or sleep related breathing. The good news is that identifying the cause can make the situation much less frustrating. Instead of waking up every morning thinking, here we go again, you can start looking for the pattern. Did the symptoms begin after a new medication? Are they worse when the bedroom is very dry? Do you wake with a completely dry mouth? Do you snore? Do you have nasal congestion? Do symptoms become worse after late meals? Are you coughing during the day as well? These simple observations can give your healthcare professional much more useful information than simply saying, I have mucus. And as you start paying attention to these patterns, you may discover that your body has actually been giving you clues for quite some time. The goal is not to become frightened by every symptom. The goal is to become a better listener. Aging does not mean ignoring changes. It means learning which changes are ordinary and which ones deserve attention. So, if you wake up with phlegm every morning, remember the five major possibilities we discussed: drainage from the nose and sinuses, mouth breathing and sleep related breathing issues, dehydration or a dry environment, medication related dry mouth, and reflux. You may have one factor or several working together. The answer is not necessarily a miracle drink, a supplement, or an internet remedy. The real answer is identifying what is actually happening in your body and addressing the underlying cause safely. Tomorrow morning, before you immediately start clearing your throat, take a moment. Notice whether your mouth is dry. Notice whether your nose is blocked. Think about whether you snored. Remember when you last ate. Notice whether the mucus is persistent throughout the day or mainly present when you wake. That small moment of awareness can help you recognize patterns that you may have overlooked for years. And please remember, this video is educational and cannot diagnose the cause of your symptoms. If your phlegm is persistent, worsening, associated with concerning symptoms, or interfering with eating, sleeping, breathing, or daily life, speak with your doctor or another qualified healthcare professional. If you take prescription medications, never stop or change them simply because you suspect they are contributing to dryness. Your body is constantly communicating with you, and sometimes the message is subtle. A dry mouth, repeated throat clearing, morning phlegm, or nighttime coughing may be nothing serious, but they can also be clues worth investigating. You deserve to understand those clues rather than simply accepting discomfort as an unavoidable part of getting older. If this video helped you understand why you may be waking up with phlegm every morning, please give it a like and subscribe to Daily Health Dose for more practical health information for adults over 50. And if you know someone who constantly wakes up clearing their throat or complaining about thick mucus, share this video with them. Sometimes one simple piece of information can encourage someone to finally ask the right question. Take care of yourself, listen to your body, and remember that getting older does not mean you have to stop paying attention to how you feel.